It's interesting. People will say to us, well, you know, other companies came into Maine and were nonprofits, and now they're not nonprofits anymore, you know? So what makes you any different? You know, are you guys in 20 years going to look like everybody else? We, under the law, must always be a nonprofit. We cannot be sold for a for-profit to a for-profit entity, and that's again under the Affordable Care Act, and it's part of the, you know, need to take revenues over expenses, which is why they call them revenues over expenses instead of profits, and put those toward, you know, the robustness of the plans, the cost containment, and then again repaying their loan to the back to the Center for Medicare and Medicaid. So does that answer your question?
Yes.
Okay.
Chairman?
How is income determined? Is it net income or is it gross income?
Modified adjusted gross income, and that's as far as I can go on that, because the tax stuff I'm trying to figure out on my taxes where the modified adjusted gross income is, but that's where it is. What's included. So you'll need to look, you know, and again, you know, with a tax person on what that looks like for you, because people are asking that if they have a sole, you know, if they're the only person in their business,
right?
What gets included? And I would be lost, so I'm not even going to go there. But that's really a tax question. But I can tell you it's modified adjusted gross income, and from there you can kind of see what's included. And certainly on healthcare.gov, again.
Is that on the calculator?
Go check the healthcare.gov. You know, you can start writing in some questions, and you should come up with how they're doing those calculations, and then I think they'll either link you to how to determine that. And again, you're going to make an attestation based on what you think is happening next year. You know, some people's income is very consistent year to year, and some is not. So you're basically saying this is what I expect for next year in the process of going through healthcare.gov. Is that okay?
Yeah, good enough.
I'm not going to go there with the tax stuff.
I just want to say that I just don't find this affordable. I find it ferociously expensive. I did go on Maine Community Health Options website, and for my age and my region, it was $450 a month, which is over $6,000 a year, and the deductible was $6,500 a year. But perhaps I was in the wrong place, because now I found out tonight I can't even get catastrophic. That's only for 30-year-olds.
Or income, and I don't, you know, that's where you really want to go potentially to a navigator and ask them based on your income. I don't know if you remember the chart up there, but depending, you know, for people at 100% of the federal poverty level, it's 2% of your income that would be where things are capped in terms of what you're supposed to pay for a monthly premium. At 400% of the federal poverty level, so for an individual that's around $45,000, that's 9.5%. But that's what you have to walk through and see if the subsidies might help or not. And otherwise, you're seeing it really, what is affordable, what are the, you know, the deductibles, the out-of-pocket. We talk to people who call in and say, I have had a $15,000 deductible, and we've hit it, you know, 3 times in the last 6 years, and it's devastating. So now, under the law of the Affordable Care Act, the out-of-pocket maximum, where you can start to finally put your hands in your pockets if you're staying within in-network providers and say, I'm done now, my plan covers for, you know, these covered services. It's now $6,350, $6,350 for an individual, $12,700 for a family. I'm not in any way suggesting that's not a lot of money, but that's the out-of-pocket maximum now, which is under the Affordable Care Act for these qualified health plans, is